Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering the parathyroid glands, the pancreas, and diabetes mellitus. I'm going to be going over type 1 and type 2. This is the third part of my endocrine series, and before we get started, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Press that like button now so you don't forget. Subscribe to my channel if you haven't done so already. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. Okay, guys, so excuse me. Let's get started. Parathyroid glands. Now, if you can recall, if you haven't watched the first two segments, you really don't have to watch it in order, but I encourage you to make sure you watch part 1 and part 2. It's going to make more sense to you as you watch part 3. But remember, the parathyroid glands, those are those nodules, usually it's 4 of them, that are embedded in the thyroid gland. Okay, so your thyroid gland sits right here in your neck, and then you have your parathyroid glands. The parathyroid glands, these are embedded in the connective tissue that surrounds the thyroid gland. The parathyroid glands secrete parathyroid hormone. So you need to know that the parathyroids are responsible for PTH, which is your parathyroid hormone. This is a small protein. Look at this. It regulates the calcium level of the blood and tissue fluid. Now, let me be more specific. You see how it says it regulates the calcium level? Parathyroid hormone, let me tell you how, what it does by regulating. Let me be more specific. It increases the calcium level. So the more parathyroid hormone the patient has, it's going to make the calcium level in the blood increase. Well, if the calcium in the blood is increased, where's this calcium coming from? The bone. So think about it. If that patient has too much parathyroid hormone, they're going to have a lot of calcium in the blood and not enough where? In the bone. That can cause the patient to have fractures, right? It can make the bone porous. So when you think of the parathyroid gland, I want you to think of calcium in the blood. And here I wrote on the side, increased PTH equals increased calcium where? In the blood. And the reason I keep saying that as students, you keep thinking increased calcium, but you keep thinking about the bone because you know that the bones need calcium. But when we are talking about these electrolytes, we're talking about the serum level, the blood level. So parathyroid hormones responsible for calcium in the blood. So it's going to make the calcium in the blood increase and the calcium in the bone decrease. Let's keep going. Appropriate concentrations of calcium are essential. When you see that word essential, pay attention. That means important. Always stop when you're reading and you're studying and you see something that says this is important to know, or this is a priority, or this is essential. Okay. Appropriate concentration of calcium are essential for normal nerve and muscle function, bone metabolism, cell membrane permeability, and blood clotting. That just told us a lot. This is why calcium is important. Having enough calcium in the blood. Calcium is important for nerve conduction, muscle function, bone metabolism, cell membrane permeability, and of course, clotting. Clotting is important because if you're not clotting enough, you'll bleed to death, right? Let's keep going. Parathyroid hormones also activate vitamin D, which increases the amount of calcium absorbed from the intestine. Here's the thing, guys. You can have as much calcium as you want. But if you don't have vitamin D, you're not going to absorb that calcium, and that calcium is not going to do what it's supposed to do. Remember, go back up here. Look at everything it's responsible for. Nerve function, muscle function, bone metabolism, clotting, right? You need that vitamin D in order to absorb the calcium. So it's not enough to have calcium. You need the vitamin D to absorb it. And where's it being absorbed? In the intestine. Let's keep going. When the calcium concentration rises above normal, the parathyroid glands slow the secretion of PTH. That makes sense. If the patient has too much calcium in the blood, do they need any more PTH? No, because PTH increases the calcium levels in the blood. If the calcium levels in the blood is already high, they don't need more PTH. That's what it's saying to you. So if the calcium in the blood's already high, the secretion of PTH is going to be decreased because it's not needed. This you need to know. Look at this. So when calcium concentration is high, and when they're talking about concentration, we're talking about the blood. When the calcium in the blood's high, the parathyroid glands secrete less PTH because it's not needed. Calcium concentration decreases. When the calcium concentration becomes very high, calcitonin is released from the thyroid gland. Calcitonin is very important. I talked to you guys about this in part 2. I'm going to talk about it again. When the calcium level in the blood is very high, calcitonin is released. What does calcitonin do? It decreases the amount of calcium that's in the blood. All right. Well, if calcitonin decreases the amount of calcium that's in the blood, that calcium that was hanging out in the blood, where does it go? Back into the bone. It makes the bone stronger. Right? So let's keep going. So it says when the calcium concentration is very high, calcitonin is released from the thyroid gland. And right here I wrote it decreases calcium in the blood and increases calcium in the bone. This hormone quickly inhibits, it quickly stops removal of calcium from the bone. So take a look. When the calcium concentration in the blood is too low, there's not enough calcium in the blood, the parathyroid glands secrete more PTH, and it makes sense because we know PTH increases the calcium level in the blood, and then calcium concentration increases. When parathyroid hormone secretion is too low, the calcium concentration is going to fall. Why? Because the parathyroid hormone is responsible for increasing the calcium levels in the blood. How many times has the author of this book told us the same thing? 1,000,000. Why? It's important for you to know you're going to see it on a test somewhere. So when PTH is low, the calcium concentration is going to be low. Well, if the calcium concentration is low, what can happen? Why are we worried about this? Take a look. This causes the muscles to twitch and go into spasms known as tetany. This is important. I put a star next to it. If you guys are new to my channel, anytime you see I put a star next to something or I put NCLEX, ATI, HESI, that means most likely you're going to see it on a test. Make sure you know it. You have to know those signs and symptoms of hypocalcemia, which is when the calcium in the blood is low. It causes muscle twitching. Spasms of the larynx muscles interferes with respirations. That's your airway. Imagine the muscles in your airway spazzing. Air can't get through. The patient can die. That's very important. So it's very important that you're looking at those calcium levels and making sure that it's not too low. Too much PTH, so now we're going on the other end of the spectrum. Too much PTH is going to cause too much calcium in the blood. All right. Why is that a problem? The bones will get weak. Remember, that calcium in the blood is taking calcium away from what? The bones. So the bones will be weak. The patient's going to be at risk for fractures. Now, here's the thing. Your kidneys are going to try to help you. So your kidneys are going to try to filter out all of those, all of the calcium. And then what happens is those calciums, they tend to just clump up. And before you know it, the patient has kidney stones. Calcium stones. And let me tell you something, those kidney stones that are made of calcium, those are one of the worst type of pain a patient can ever have in their life. So it's very important that the patient doesn't have too much calcium in the blood, but it's also important that they don't have too little calcium in the blood, okay? Now let's talk about the parathyroid glands. I'm just joking. I just talked to you about the parathyroid glands. Let's talk about the islets of Langerhans. We're right here. So guys, the islets of Langerhans, that's in the pancreas. And remember, the pancreas is the only organ in the human body that has both endocrine and exocrine functions, right? So for this video, I'm only going to talk about the endocrine function. When I get to exocrine, I'll talk about that, but very quickly about the exocrine, you know, certain enzymes are released for the exocrine, but let's talk about the endocrine. That's what we're focusing on. But just so you know, the pancreas is the only organ that has both functions. It has endocrine and exocrine function. So for the endocrine function, what we're going to focus on is insulin. So let's get started. The pancreas has both exocrine and endocrine functions. We have islets of Langerhans. And in the islets of Langerhans, that's in the pancreas, guys, you have beta cells and the alpha cells. Both of them are important. Let's find out why. Beta cells produce the hormone insulin. Insulin is what decreases the patient's glucose levels. Let me tell you something. When sugar is in the blood, it's doing absolutely nothing for the body. Sugar is fuel for the body. The tissues of the body need sugar in order to be effective, right? But if it's stuck in the bloodstream, it can't get to those tissues. So insulin, that hormone insulin, is like the key that unlocks all of that sugar that was stuck in the bloodstream to get out of the bloodstream and go to those target tissues and organs where they can be used. All right. So that's what the beta cells important for, the hormone insulin. What about the alpha cells? The alpha cells secrete the hormone glucagon, and it does the opposite. You see how when we talk about the beta cells, that's responsible for insulin, and insulin decreases glucose in the blood? Well, when we talk about the alpha cells, that releases glucagon, and glucagon increases glucose in the blood. All right. Insulin lowers the concentration of glucose in the blood. Glucagon raises the blood glucose concentration, and it does that by stimulating the liver to convert glycogen to glucose. Glycogen, by the way, guys, is a stored form of glucose. Okay. Secretion of insulin and glucagon is directly controlled by the blood glucose level. Think about it. If remember your normal blood glucose fasting 7110, right? So let's say your blood glucose is high. What do you think is going to happen? You expect those beta cells which are located in the islets of Langerhans to release insulin to lower the blood glucose. What if your blood glucose is low? You expect the opposite. You expect the alpha cells to go ahead and secrete, oh my gosh, what's it called? It starts with a G. I'm having a brain fart. Glucagon, to release glucagon to increase the glucose levels. Okay? Look at what this says. If the glucose concentration is too high, you have too much sugar in the blood, the beta cells, remember the beta cells, that's what's responsible for insulin. The beta cells secrete insulin, then the cells remove the glucose from the blood, and the blood glucose concentration decreases to cause homeostasis, because everything that your body is doing all day, every day is to promote homeostasis. Homeostasis is the balance. You always want to be balanced. You don't want one thing to be higher than the other, okay? On the side here, it got smudged, but I wrote it because you're going to have to know this. The fasting blood glucose should be 70 to 110. Now, let's say the glucose concentration is too low. The patient has hypoglycemia. They don't have enough sugar in the blood. Now, the alpha cells is what kicks in. The alpha cells secrete glucagon. Liver cells convert glycogen. Remember, glycogen is a stored form of glucose. So the liver cells convert glycogen to glucose and produce glucose from the non-carbohydrates. Blood glucose concentration increases, and that causes homeostasis, the balance that we're always looking for. Now, what I just explained to you about when the patient has hyperglycemia, when the sugar is too high and everything that happens, and when the patient has hypoglycemia, the blood sugar is too low and everything that happens, all of this is negative feedback. You need to know that. When the glucose level rises, insulin release brings it back to normal, and when it falls, glucagon acts to raise it again. This is the negative feedback system. So why is it important to maintain a constant blood level? Here's why. The brain cells, they can't store glucose. So they need a constant supply all day. Okay? Look, brain cells cannot store glucose and ordinarily are unable to use other nutrients as fuel. Glucose is the fuel for the brain, but it can't store it. So it has to have that constant supply. These cells depend on a continuous supply of glucose. All right, last, let's talk about diabetes mellitus and the most important things you guys have to know about type 1 and type 2. So diabetes, this is a disease that affects people all over the world, okay? Insulin-dependent diabetes, this is referred to as type 1 diabetes and usually develops before 20 years old. This is what used to be called juvenile onset diabetes. So you need to understand, if the patient is a type 1 diabetic, they're insulin dependent. They have to get an exogenous source. When I say exogenous, that means the outside source. They have to get an exogenous source of insulin, or guess what? They're going to die. It's not if, it's when. And it's not going to be long, okay? If they are type 1 diabetic, what that means, remember, in the pancreas, you have the beta cells, which are responsible for insulin, right? That patient with type 1 diabetes, either the beta cells don't work, the pancreas isn't working like it's supposed to, or maybe it does work, but just very minimally, not enough to keep the person alive. They're type 1 diabetic. They have to get an outside source of insulin to stay alive. That's why it's called insulin-dependent diabetes. That's your type 1. Something else you guys need to know about type 1 diabetes, this is an autoimmune disorder. Whenever you see autoimmune, I want you to think of the body attacking itself. The body is what's causing the disorder that the person has. So type 1 is an autoimmune disorder. Look at this, in which cells of the immune system, that person's own immune system, kills their own beta cells. And remember, the beta cell, that's what's responsible for the insulin. So if they're not making any insulin, they have to get an exogenous source to live, right? So that's your type 1. Now you have type 2. Type 2 is known as the non-insulin dependent diabetes or type 2 diabetes. Those patients who are type 2 diabetics, usually they don't have to have insulin to live, because those patients who are type 2, like 90% of your type 2 diabetics, if you get them to start exercise and start to eat right, their glucose will fall, because what happens with the type 2 diabetics, they tend to have insulin resistance. But as they lose weight, as they exercise, their glucose start to fall, right? They're not dependent on insulin. So that's why when it comes to type 2 diabetics, you'll notice the healthcare providers will always try diet and exercise first, and then they'll try oral hypoglycemics, and then all of that doesn't work. In addition, they may add insulin, but insulin usually is not the first go-to for the type 2 diabetics, but it's always the go-to for your type 1 diabetics, okay? So a non-insulin dependent, this is type 2 diabetes, patient's gonna have insulin resistance. You're going to teach a patient, you can reduce your risk of type 2 diabetes by eating a healthy diet, engaging in regular physical activity, at least 30 minutes of moderate intensity exercise daily, and avoiding tobacco use. Most of the type 2 diabetes, you can reverse it. Just because you're type 2 doesn't mean you have to be type 2 all of your life. Most of them, with proper diet and exercise, they can go back and revert and not be a type 2 diabetic, okay? So that's very important to teach the patient. Now, too much glucose in the blood, this is what's known as hyper. Whenever you hear or see hyper, that means high, too high. When you hear or see hypo, that means too low. So hyperglycemia, hyper, high, glide, that's the sugar, emia, in the blood, too much sugar in the blood. When you guys are reading and you see a word and you don't understand, for the love of God, please don't just keep reading and pray you don't see it on the test. That one word that you looked over, that's going to be the thing that's going to trip you up when you take your test. Take the time and look up that word to see what it means. Okay, so too much glucose in the blood, this is what's known as hyperglycemia. Instead of normal fasting of around 90 milligrams per deciliter, the patient may have, look at this, from 300 to 500. Remember, normally your fasting blood glucose is supposed to be 70 to 110. Now, if you're a diabetic, you expect the fasting blood sugar to be a little bit higher, that's okay. But look at this, 300 to 500. That definitely is hyperglycemia, right? Glucose does not normally appear in the urine. However, in diabetics, the blood glucose concentration can be so high that the glucose is excreted in the urine, and this is known as glycosuria. Glycose, glucose, sugar, urea in the urine. Sugar in the urine. So what happens, guys, that patient's blood sugar can be so high. Remember, your body's going to try to survive no matter what. Your body's going to try to reach homeostasis, that balance I keep talking to you about, no matter what. So when that blood sugar gets too high, your body's like, whoa, we got all this blood sugar. We're about to die. We got to do something. So the patient starts spilling out that sugar in their urine, and that's the glycosuria. Okay? Because cells cannot take up the glucose they require for fuel, they turn to fat and protein for energy. Remember, your tissues, your organs, they need the glucose to keep going. So if the patient has hyperglycemia, all of that sugar is stuck in the blood, your tissue's still trying to survive. So they're like, you know what? We're not getting the glucose that we need to survive. Let's start feeding on the fat and the protein because we still need that energy. And the byproduct of that fat and protein metabolism, guys, that's what causes ketones in the urine. And the book really doesn't go into that. You really start learning about that in med-surg, but I'm letting you know because NCLEX definitely expects you to know that. So I'm just letting you know, ketones in the urine, this is the byproduct of the patient's body, the blood sugar being so high and the tissues needing the glucose. They can't get the glucose because the glucose is stuck in the blood. So then start feeding on the protein and the fat. It causes this byproduct that's known as ketones, and patient will have ketones in the urine. And guys, that is the end of part 3. That was very quick. Part 4, guys, I'm going to be going over the adrenal glands. I'm going to be going over the adrenal cortex and the adrenal medulla. Let me see. Yep. Both of them, because that's heavy as well. So that's going to be the next video. So guys, let me know what you thought about this video. Let me know what you'd like to see me cover more on. Don't forget, every Sunday, 1 p.m. Eastern Standard Time, I have a video that's released where I cover NCLEX type questions, and I teach you how to answer these questions and how to eliminate wrong answer choices. Don't forget, on Sunday, October, what is that date? Sunday, October 31st, 30th? Give me a second, guys. I'm having a brain. 30th, excuse me. Sunday, October 30th at 1 p.m. right here on YouTube Live. I'm going to have an NCLEX review going over priority and delegation. This is free. This is absolutely free. So if you know anybody that's studying for their boards, or they kind of need that push, or maybe there's just a couple things they don't understand, come join me on that live. I'm going to be going over important information for you. Don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. And almost daily, guys, you guys can find me on my other social media platforms covering a variety of nursing topics, such as TikTok, Instagram, and Facebook. Guys, thank you so much for watching this video, and you guys will catch me on the next video.